Welcome, everyone. Welcome, everyone. Thank you for having us today. My name is Diana Pajwan. I am the Senior Project Manager with the Projectfirstline team here at NCUIH at the National Council of Urban Indian Health. Today's event will be facilitated by Kyle Mitchell, followed by presentations around infection risk recognition by Karen Kwok and Marie Zephier, who are experts in their field. We will look at recognizing infection risks in healthcare and taking actions to protect staff and patients within our urban Indian organizations. I'll be your host today for today's session. Next slide, please. Welcome. Move on to the agenda, housekeeping. Next slide, please. A brief rundown of our agenda for today. We'll go through welcome and introductions or training objectives. We'll hand over to Kyle Mitchell, who will walk us through storytelling around what risk means within the Native American, Alaska Native and Alaska American Indian and Alaska Native communities. We'll go on to understanding the historic perspectives on risk recognition. We'll transition to Karen's presentation. We'll look at risk recognition and an infection control program. We'll transition to Marie Zephier, who will walk us through the quality aspect of this. We'll open up with a Q&A and then wrap up. Next slide, please. Just a few reminders as we go through our presentation. Please turn on your videos, mute your microphone when not speaking. Kindly enter your name and organization into the chat box. Another reminder is, next slide, please, is to please take our survey at the end of the session and let us know how we can serve you better to make it easier for you. You will find a QR code at the left-hand corner of all our presentations. You can easily scan with your phone, and you can complete this as we are going through. Next slide, please. We are a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUIH is the only national representative of the 41 Title V UIOs under the IHS in the IHCIA. NCUIH strives to improve the health of over 70% of the American Indian and Alaska Native populations that lives in urban areas, supported by quality, accessible healthcare centers. NCUIH strives to create a broad awareness of Indian health issues while maintaining a visible presence in DC. We track legislation and provide congressional testimony, as well as distribute news, resource updates, and legislative alerts. We hold conferences, webinars, and host an interactive website that helps to disseminate information and facilitate partnerships. NCUIH is the only national nonprofit organization devoted to support the development of quality, accessible, and culturally competent healthcare services for American Indian and Alaska Natives living in urban settings. Next slide, please. Projectfirstline is a national collaborative led by the U.S. Centers for Disease Control and Prevention to provide infection control training and education to frontline healthcare workers and public health personnel. NCUIH is proud to partner with Projectfirstline as supported through a cooperative agreement titled CDC RFA OT 18-1802. CDC is an agency with the Department of Health and Human Services. The contents of this program do not necessarily represent the policies of CDC or HHS and should not be considered an endorsement by the federal government. Next slide, please. This is our second year of rolling out training around Projectfirstline, and just a brief recap of what Projectfirstline is. Many of you are familiar with Projectfirstline. It is the CDC's national training and education collaborative for healthcare infection prevention and control. Every frontline healthcare worker deserves to understand infection control principles and protocols, and the CDC's Infection Control Training Collaborative, Projectfirstline, is committed to helping every frontline healthcare worker increase their knowledge and understanding of infection control. They aim to achieve this through providing clear and effective infection control resources and CDC recommendations while also considering the needs and preferences of the healthcare workforce. Next slide, please. Most of you are familiar with NCUIH Projectfirstline team from year one. We're represented by our director or VP, as well as our program manager and the rest of our team. And next slide, please. I'd like to introduce a new member of our team who will be facilitating our webinars. I'd like to introduce Kyle Mitchell, who is a decorated Army veteran and is a Purple Heart recipient as well as a Bronze Star with Valor. He's a graduate of Arizona State University with a focus in communication. As a program manager with a background in business development, he founded Filsovita, which translates to bushes where the yellow flowers are. And Kyle, if I've butchered the name of your organization, please go ahead and correct me. It is an organization that provides a professional service in sharing oral traditions in hopes of breaking down stereotypes. As a trainer and facilitator, Kyle serves as a senior program analyst in the Office of the Vice President of Academic Affairs Office at South Mountain Community College. He uses storytelling to connect with Indigenous students and with his own teenage childhood. Within Navajo culture, at least the way that I see it and the way I've been brought up is that we always move forward, Mitchell says. We move forward with three things: songs, prayers, stories. So everything we do in our culture is related to those three things. And I've quoted Kyle. With relation to this quote, I would like to transition to Kyle to open up our presentation with storytelling as we move forward with the three things: songs, prayers, and stories. Kyle, welcome.
Thank you, Diane, very much. Hello, everybody. My name is Kyle Mitchell. I am Dene. So within our language, we always say hello. So hello in Navajo is Yate. So Yate, everybody. My name is Kyle Mitchell. Like Diane said, the company I have is called NCUIH. So don't worry, it's a tongue twister for everybody. So what I'm going to be doing today is really kind of talking about, just slightly touching on historical context, a little pre-contact and post-contact. But before I do any of that, I'd like everybody just to join me for just a few seconds of silence in honor of the land that we are on. Before the land is the way we see it now, there was stewardship there. There was people thriving and living pre-contact. So we just want to acknowledge those that were there before us. Thank you. One reason why we do that with land acknowledgements and why they're so big is because it really gives respect. It shows the value and the dedication, the kind of due diligence to understanding the ground that you're built upon. So if you have time while you're seeing patients, while you're talking to community members, it would be good just to ask them about the geographical space that you're in. And I think that would be very beneficial in helping starting the conversations around risk. So the historical context is pre-contact, right? So we think way back prior to the 1400s, in a time of untapped resources here in America. We had tribes from coast to coast, each with their own societies, their own communities, each with their own diversity. One thing I always tell people about any indigenous culture community is that we're not a melting pot, meaning that things don't just come together and we're not all the same, but we're more of a mosaic, right? We're each individuals, we have our own moral beliefs, our own traditional cultures, things like that. And so once there was contact made by the Europeans, that's when everything really changed for the way of life here. We saw the food source go down as far as the plants, the crops, along with all the game and the food that we relied on to eat. And then that's when we really first got introduced to the major health risk, such as smallpox, influenza, and measles, and chickenpox. Actually, chickenpox were very detrimental to the American Indian population. And so when we think about risk within the community, we think about the chance, right? Like something's going to happen, and how can we alleviate that? And how can we better understand that? And within indigenous cultures, a lot of times you have to name it, right? You have to explain what's going on, kind of bring it from a worldview down to an individual view. And the only way I could think of how to kind of connect those two things is really sharing an experience I had. And so that experience is, I think it was the beginning of last year, beginning of 21, when we were starting to do some rollouts on the Navajo Nation in the response to COVID. And so the great risk obviously was COVID, and how do we minimize that? What things can we do? And so we looked at PPE, the vaccine, different things along those areas. But as we went into the community, up on the Navajo reservation, right? So when you think of Navajo, everybody thinks of the majestic landscape of Monument Valley, the high desert, beautiful landscape. But behind that is the people within the culture who are thriving and surviving to this day. And so when COVID-19 started and we had to go help and assist out there, what we did is we had the PPE, like I said, we were able to hand it out. But as we were handing it out, a lot of people really didn't understand the reason why. So why do you have to wear a mask all the time? Why do you have to do these different things? So we had to kind of break it down and say, for example, within Navajo culture, right? Everybody wears turquoise. And so with that turquoise, that is protection towards like unseen threats. And so when we're handing out masks, that's how I related to that, along with the vaccines and the boosters. So they were able to really understand, like, okay, now I understand. So there was a comparison there. And one thing that I really wanted to touch on is that now that the main conversation and the main topic in the world is the pandemic, COVID-19, this is also an ideal time, an ideal space now to talk about other risks that are detrimental to our population. And so what I wanted to talk about a little bit was really highlighting the need for addressing other risks and how to identify them in the healthcare and the benefits of this webinar. Next slide, please. Oh, next slide. Okay, all right. So what we're going to talk about today, here's some training objectives we have. So today we'll be discussing the concept of risk recognition and how you can apply it to prevent infections in the healthcare. We'll have the opportunity to reflect before we wrap up for the day. To achieve this, we will have 4 training objectives for our session today. The first one is to understand what is considered an infection risk in healthcare. Second is to recognize infection risks in various healthcare settings. Third is to understand how a robust infection control program can support infection risk recognition. And lastly, to review the new resources that can allow for active and passive learning in infection control. Next slide, please. All right. So below here are the data chart you see here. This is a snapshot of today's UIOs, new and re-emerging infectious threats. The infectious disease inequities affect Native health disproportionately, with COVID, TB, HVC. In the table here, you see that, that the all-time COVID cases are higher among AI and AN, American Indian and Alaska Natives, in our urban communities when compared to non-Hispanic whites across the nation. Recent data from the CDC reported in 2018, the rate of TB disease was over 8 times higher than non-Hispanic whites. Next slide, please. All right, so here's the data continued talking about acute hepatitis C. American Indian and Alaska Natives have been historically disproportionately affected by hepatitis C, with CDC data showing an increasing trend since 2003. How big of a problem is COVID, TB, HCV in our native communities? Well, research allowed the quantification of the problem, but these numbers also help inform the need for infection control programs. With effective UIO infection and control programs, we can target decreased spread of COVID, TB, HCV, and so that our Native elders, families, and communities can live healthier lives free of infection. Next slide, please. All right, so surveillance of infectious disease among American Indians and Alaskan Natives. The background on the importance of infection risks and threats to infection control. Research has shown that it is challenging to track Native people's infection rates due to migration and surveillance systems. Due to difficulty in access in maintaining continually of services, it is a priority to ensure that when, where, how the Native people across these services that staff can immediately recognize and stop infection spread when it is recognized. Next slide, please. So with all that said, what does infection risk mean today in our UIO healthcare settings? And so to talk about that, next slide, please, I would like to welcome up Karen. Before I welcome her up, let me read her bio, which is amazing. Karen is a champion of this program, and she has joined us for year 2. She was very beneficial and very strategic to the first year run. So Karen holds a dual master's degree in nursing and in public health and is nationally certified family nurse practitioner. She has over 20 years of experience working in healthcare equity with resilient communities, including coordinating care for UIO patients, specifically San Francisco, California Native American Health Center. She has provided direct patient care, and special delivery operations workflow in infection prevention and control, and has prior consultations experience in disaster relief and post-Hurricane Maria in Puerto Rico and CDC Biosecurity Project. Her public service is recognized with the American Nurses Credentialing Center, the Robert Wood Johnson, Bill and Melinda Gates Institute, California Governor Gary Davis, President Obama, and Fulbright specialists. Please join me in welcoming Karen.
Thank you, Kyle, for allowing us to see through the eyes of your story with the lens of community and healthcare staff with infection risk. From sharing the Alaskan, Native, and American Indian perspective, we will explore further how UIOs are already protecting the safety of their Native communities through their infection control programs. Next slide, please. With infection risk in healthcare, we are on duty as a community member, healthcare worker, and patient. While the audience members here are thinking of their own responses to these questions, I invite you all to type your response in the chat and share examples of risk, infection risk, and risk recognition. We can compare notes. So risk is a part of life where something bad can happen. Infection risk is the potential for a germ to spread. And risk recognition is seeing the potential for a problem to happen. And I'm just looking at the chat box to see if there were any other thoughts that the audience members would like to share. And you can do so throughout the presentation. Moving to the next slide. With delivering health services, protecting patient safety and caring for patients is a top priority. Particularly with the pandemic, we have all come to appreciate the adaptations of clinical practice with research for guidance. like the data statistics that Kyle just shared. In this lecture, we will build upon UIO knowledge about germ spread, recognizing infection risks, and decision points for preventing infections when patients receive care. Next slide. Because risk will always exist in healthcare settings, we follow these standard precautions to protect patients and themselves. And in this short video, we'll call upon the audience to pick out risks that they recognize for infection spread in healthcare. And so this brief video, we can start playing now, please.
You deal with risks every day at work. Think about times when you're mopping up a spill, checking a medicine dose, or when you see a wobbly patient about to fall.
See the video. Are you
see a
to the video? Technology. The video will play in a little bit, but we can continue talking about risk, Karen, if you want to go ahead until
Okay.
Lamar gets the video up and running.
Okay. So I'll speak to the next slide then. Because risks will always exist in healthcare settings, we follow standard precautions. And I see one of our champions here in the audience from Bakersfield. We had covered in depth regarding hand hygiene, PPE selection, cough etiquette, safe injections, device reprocessing, and environmental cleaning as part of standard precautions. It's the things that the UIOs are already doing every day for every patient to keep germs from spreading. Layering upon that, we want to also take into account how certain bacteria are spread, and the proper patient placement depends on this known or suspected organism and how they do spread. Because healthcare is dynamic, knowledge of the 5 elements for germs to spread and the 4 common pathways will help UIOs prepare for the unexpected. Wanted to pause and see if we were able to, oh, there we go. The video's coming up.
You deal with risks every day at work. Think about times when you're mopping up a spill, checking a medicine dose, or when you see a wobbly patient about to fall. You see a possible problem that could hurt a patient, and you take action. You can use this same process of recognizing risk when it comes to infection control in healthcare. If you learn to spot the opportunities for germs to spread, then you can step in and take action to stop the spread of germs. So why are we so focused on germs in healthcare? The risk for germs to spread is different than it is at home and in the community. There's a higher chance for germs to spread in healthcare settings than, for example, a grocery store, because it's where patients who are sick come for care, and patients who are already weak or ill are likely to be more vulnerable to infection. Healthcare is also unique because some of the things healthcare workers do as part of giving care can put patients at risk of infection, like starting an IV. Sometimes we are the opportunities for germs to spread. We interact with a lot of people throughout the day. We touch a lot of things, and we use many different kinds of equipment. And these are all ways we can spread germs. All of this is why we have to think about infection control in healthcare differently than we think about infection control in the community.
And so in watching that video, we'll go to the next slide, which is looking at testing your knowledge. So the question is, why does germ spread have the highest risk in healthcare? And in the poll, or in the chat box, you can indicate which is the most appropriate response. It is where individuals who are sick come for care. Individuals who are already sick are more vulnerable to infection. Multiple interactions between patients for healthcare workers. When there is a way to break down the body's defenses, there is a risk for infection. Need for equipment reprocessing involves potential for infection risk, or all the above. And so I'll give the audience a few seconds to choose their response. And so we'll start closing the poll right now and see, and you are absolutely right. You're right there with me. Great. In the next slide, healthcare is a unique setting. We consider germs differently in healthcare. I'm sorry, in the next slide. And the next slide. And so healthcare workers usually have closer interactions during care, and that is more so than in community settings. And let's look at the 5 elements for germs to spread. In brief detail, I'm just going to cover these 5 elements, because in subsequent webinars, we'll have a deeper dive into each of them. So consider in your workday all the tasks that you do. Where do you see the possibility for germs to spread and cause infection? Reservoir, that's where germs live. A pathway is how germs spread. A person to infect, it could be a patient, staff, or a community member. Ways for getting past the body's defenses is infecting the person through procedures or surgery, IV, intravenous, antibiotics or chemotherapy, and survival. Survival is how the germs continue to live on and then are able to carry out infection successfully. And we all have a role in ensuring it's stopped through any and all of these elements. Next slide, please. Regarding the 4 common pathways, these are ways that germs can spread and make people sick, either through touch, being breathed in, through splashing, or through procedures. And that's what usually happens in healthcare. In the next slide, infection control actions at any one of these key points that we just discussed can stop germs from spreading and causing infection. To make decisions about infection control, it's important to think about where the germs are, the reservoir or the reservoirs there that you're dealing with, and how the germs might get somewhere else through a pathway. Then you can recognize the risk for germ spread to happen and do something about it. In this next slide, we remember that germs are everywhere, including on our bodies and the environment. In the next slide, we'll test your knowledge again. So with the elements that we just learned, put your mindset looking at a patient who's about to get a blood draw. What are the recognized elements of infection risk? I'll pause for the audience members to list what their thoughts are for these elements. Okay, in the next slide with the response listed. So a reservoir could be, again, any place where the germs live. In this particular case, it's the skin and the blood. In the environment, it's the armrest for the phlebotomist, which is a high touch surface, dust and dirt that could be nearby, or the devices themselves. The pathway is through touch, through splash or spray, or the procedure of the blood draw. The person to infect, patient, staff. The ways for getting past the body's defenses, phlebotomy through the needle gauge, and survival, where germs survive with the reservoir, the pathway, the person to infect, and getting past the defenses. In the next slide, infection control actions at any one of these key points that were discussed can stop germs from spreading and causing infection. To make decisions about infection control, it's important to think about where the germs are, and then recognizing that risk, stopping the spread from happening. In the next slide, with recognizing reservoirs, the places where germs live throughout our workday, it's the first step to being able to see the risk for germ spreading and knowing when to do something about it so we can protect our patients and ourselves. In the next slide, I just wanted to highlight that resources are available from the CDC and will be shared through our slide deck, and it's listed in detail at the end of the content that we've shared with you here. And so in order to ensure the responsiveness of UIO infection control programs, you can utilize these same resource links such that you can bolster up the successes you've already had in infection control and refine your program strategies as well. In the next slide, I just wanted to highlight that each of us are important and have power in protecting our Native communities by recognizing as health workers, we also are the ample opportunity for germs to spread. So through each interaction that we have with our coworkers and our patients, the things that we touch, the devices that are reprocessed, we can control, and we have the power to prepare our UIOs to protect our patients from the spread of germs. And so now, in the next slide, I'll be introducing Marie, who will give a specific UIO example where a QI tool helped explore lessons learned with recognizing infection risk. Marie is an owner of Red Day Women Consulting and serves as a consultant with the National Council of Urban Indian Health. She has over 15 years of tribal health quality experience, facilitation, strategic planning, data analysis, and process improvement. She received her bachelor's from Creighton University, along with her master's in public health policy and management from University of Arizona. I introduce Marie and I'm excited to hear what she will share with us now. Thank you.
Thank you, Karen, for that introduction. Ampatuwaste Mitakyapi, or good afternoon, relatives. My name is Marie Zephier, and I'm a member of the Oglala Lakota Nation from Pine Ridge, South Dakota. And I'm really honored to be part of this NCUIH Projectfirstline team. Today, we'll be discussing how UIO's robust programs relate to risk recognition. It's also important to note that American Indian and Alaska Native populations are often transient from reservation to urban areas. First of all, this not only traditionally aligns with nomadic tribes in various regions, but it shows how the data can be skewed and really create an opportunity where tribal members could fall through the cracks. This creates another layer of need for UIOs to integrate data-driven tracking systems. Next slide, please. As I mentioned, we are going to talk about the understanding how a robust infection control training program can support infection risk within urban Indian organizations. Next slide, please. So why implement QI to support infection risk recognition? Quality improvement can support infection risk recognition for the purpose of decreasing patient and healthcare worker harm. This CDC really focuses on continuous improvement and operational excellence, and infection risk recognition is a huge component of that. And it also helps us to monitor what's best for patient safety. UIO staff are often American Indian people, and they know their communities. They're from them, tribal members. Identifying these stakeholders helps to increase awareness and also creates buy-in where the people involved in the change process can really have ownership and feel proud of those changes. American Indian people are actually historical planners, and talking in change teams, it helps create that buy-in through relational models and also the talking circle that's typical in many of these communities. UIOs can conduct an infection risk assessment along with IC training as part of their QI plan. Next slide, please. Recognizing infection risks in healthcare is important due to the germ spread. It's actually higher with patient illness within the facility. Quality improvement allows us to identify areas of improvement and implement change strategies that can be monitored on a continuous basis. Our ultimate goal is to create positive change for the patient, and we really want to create an environment that's best for healthcare worker safety. Implementing new changes in process, such as new employee orientation or facility-wide annual orientation, maybe even department-specific orientation. It can really be monitored and help track which changes are great for the UIO specifically. Next slide, please. Infection control is essential. Change teams are comprised of members that are from the communities, and these tribal members are often patients. Their input is crucial regarding infection control risk recognition. In American Indian communities, I found that often word of mouth is a common practice. And when you help train one person, it could essentially train 5 more, because they'll then in turn train their family members, their coworkers, and others in what they've learned. Increasing UI patient safety is essential as well. Marsha Patrick from the AAAHC indicates it's important to take a proactive approach to preventing infections from occurring, and this can be done by assessing the risks that may derail IPC efforts. Next slide, please. The Institute for Healthcare Improvement, or IHI, uses the Plan, Do, Study, Act tool as a framework to encourage the communication, engagement, and participation of these stakeholders. This tool actually helps monitor continuous data, and it documents that data. Keep in mind that QI is an iterative process. You'll be making frequent corrections as teams, and you'll find out what works, what doesn't work. Making IC changes for risk recognition within the facility is really what's adapted specific to their needs. Stakeholder involvement is essential, especially infection risk recognition and UIOs, because American Indian people are historical data keepers and often have really beneficial feedback in the process changes. Next slide, please. This slide demonstrates some CDC existing tools. And I also want to encourage everybody to not recreate the wheel. The CDC has developed all of these risk reduction education and training materials. They can help implement new facility processes, be part of a change tool that tests whether or not it's efficient in the training. And there's also so many available. There's process maps, infection control posters, etc. Training staff on proper cleaning, high-touch surfaces, and a phlebotomy chair. For example, when speaking to infection control IC administrators, I once used the PDSA tool to document first the risk reduction interventions for Hep C. It was really important to understand the problem in our facility and how assuring that using PPE according to CDC standards can help to decrease Hep C living on the surfaces. What we did was train staff on proper cleaning and how to in high risk areas, which ended up being the phlebotomy chair. We used the PDSA to monitor whether or not environmental cleaning from direct clinical care was, and increasing the training and donning and doffing per CDC guidelines really assisted in compliance. We monitored the data on a weekly basis and found out that just increasing the education about environmental cleaning can really decrease the reservoirs for IC spread. These tools are essential. They help track, monitor, assess, and reassess change within infection control recognition. Next slide, please. Projectfirstline also has educational tools and materials specific to recognizing infection risk within your UIO. These are also great resources for strengthening your existing or implementing a new IC data monitoring program. These tools can help positively impact patient safety for your facility and are adaptable in recognizing risk infections in healthcare. They also help stop spread the germs in healthcare facilities and can really decrease the time spent in creating new materials for UIOs. From my UIO example, I hope it's clear to see how each of us can get involved in risk recognition and stop germ spread. With our UIC programs, all workers in healthcare, from the administrative level to the frontline staff, can utilize not only CDC Projectfirstline resources that we've listed here, but also QI tools and really help improve their clinical operations toward better infection control. Okay, now I'm going to hand back to Kyle for the next part of our presentation. Thank you, and I hope you all have a great day. Kyle? Okay.
Yes. Nope. All right. Sorry about that. Well, thank you, everybody. We do have a quick survey here below, right here at the. So please remember to complete the survey about this webinar so that we can provide the information you need to help improve infection control trainings. The QR code can be scanned with your phones and you can complete it in less than 3 minutes. Leo will also share the link in the chat. And while we do that, now we'd like to open up the floor for any questions you may have. So please feel free to type those in the chat and we will get to those in a panel style. So give you a few minutes.
I can share a question that was directed to me individually, or actually, let me scroll. It was regarding a fast-paced clinic environment, as all are. It can sometimes be difficult to remember the elements of risk identification and ensuring infection control. So, sorry, my scroller is going a little quickly. Let me read the question from here. In fast-paced, busy settings, sometimes it can be difficult to remember the elements of risk recognition and pathways. What recommendations do you have to help staff incorporate infection risk recognition into their shift, even when they are busy? What I've found to be really helpful is a grounding, a framework in which just to carry out my day, that things are going to pop up unexpectedly, but what are the anchors in thinking through how I can control infection? And I'll give you a specific example with chickenpox, actually. popped up, and we don't consistently always have it, but a adult that was in their 50s had a suspicious rash. Because we knew in terms of thinking through the pathway of being passed by breathing, we right away put the patient in a separate room, separate from where the rest of patients were waiting in the wait room, to protect those that might be immunocompromised or pregnant, for example. And knowing that by controlling that pathway and protecting persons who could be infected, we worked alongside our infection control hospitalists on how we could track any other possible patients who were in contact with that person for that very short time to mitigate any more varicella chickenpox cases. So it's really integrating as part of second nature how we can quickly think through when we see a risk, take an action to stop it, but then look back as to how to improve our clinic operations to be more efficient, more effective, and still deliver safe patient care. So thank you for that question.
Karen, if you, I'd like to add to this as well. One of the recent rollouts that the CDC Projectfirstline team has done during their launch event on March 16th, they released a number of different products that can be integrated into the daily lives of our healthcare staff. There are infographics, there are posters, there are animated GIFs, different kinds of tools that can be applied anywhere. A GIF could also be used as the background of a screensaver. It shows animated germs on someone's hands. So things somewhat reinforce passively a reminder that folks should be washing their hands. You should be practicing hand hygiene. There are infographics on reservoirs and germs and how germs spread. Posters that can be put up in different areas of the clinic that remind folks to be vigilant and reinforces risk recognition and infection control. And they are available on the Projectfirstline webpage, and we've added them to the chat. You can go and download a number of the tools that they've provided. There are also training toolkits for trainers in different healthcare settings based on the availability of their staff, whether it's for a few minutes, for 20 minutes, 60 minutes, or even less. They're training toolkits that have slide decks already prepared, a script outlining the presentation that one can quickly download and share the slides and go through training during a lunch and learn or any other times during the day. So there are all these different tools and resources available. I do encourage UIO members, trainers to check out the website. This helps to reinforce the training. So I think this is helpful as well. Back to you, Karen.
And I completely agree that having those cues help really ensure that while something unexpected might come up, that you follow the process. So thank you for that. I invite the audience members to share any questions that they have.
All right. Before we get to that, Karen, we do have a question for Marie. Marie,
Okay.
Are you there?
Yes.
All right, get ready. How can management and leaders help staff positively receive quality improvement programs, trainings, and policy changes? What do you recommend when staff are resistant to change?
So one way that I used to integrate or encourage staff to help with change, especially in hard areas, is the patient experience surveys that were centered around that change, and always reminding them this is for the patient, because it's so easy to disconnect with that when we're doing all these changes and having to make these adjustments, it's so easy to forget the reason that we're doing that. So just reiterating one, that this is for patient safety. It aligns with the national patient safety goals. Another thing, practice that I would use is say, these aren't this isn't my particular opinion, it's actually per regulation. And the Projectfirstline has the tools aligned directly with that. So I think it's important to reiterate that as well.
All right, thank you, Marie.
I can add on to that too,
Yes, please. Thank you, Karen.
if that's okay. So regarding the patient care experience, when you can follow what a patient is becoming in contact with for potential infection, it helps us think through how our operations could better be improved. So for the same example of my patient who had chickenpox, our building wasn't completely going to be redesigned. However, our operations could definitely be improved. When we saw how walking that patient through the weight room and then trying to find a private room to contain the varicella spread, we could better understand how each point of contact with the patient and how we could improve our services, making sure we had proper PPE selection available in certain spots rather than running back and forth to the back room. That just gives us a different mindset on how we can be better and safer.
Thank you very much for that, Karen. One more question follow-up. Who in the healthcare setting has the possibility to encounter and recognize infection risk?
Oh, go ahead, Marie.
I was gonna say everyone, because both healthcare workers and patients were natural reservoirs of germ carrying. So one way to mitigate that is visual educational materials from the CDC Projectfirstline, as Diane mentioned.
And I completely agree with Marie too. So my same example, my administrative team who was registering the patient, and the patient said, I'm here for a rash and I have a little bit of a fever. The administrative team ran and got me and said, I think we need to have a private room for the patient and right away, and coordinated with the nurse manager such that we took them right out of order from triage because of this infectious risk. And we immediately placed them in a private room to triage them and then to examine and coordinate their care. And so it was from the very front lines, my administrative team, the clinical team, and then when we took a risk analysis perspective and approach on how we would improve our infection control, thereafterwards, our clinic operations and administrative team were all at the table. So every single person has the power and the responsibility to be safe with our patient care.
All right, great. Thank you both very much for that. Before I pass the mic back to Diane, I just wanted to say thank you to everybody, both behind the scenes and on camera today, and those of you who were able to attend your busy schedule, and we definitely do appreciate you as UIOs and participating today. Just to reiterate, we just hope today's webinar helped you understand better what risk or infection risk is in healthcare, helping you recognize in different settings you have within healthcare, and then also learning about new resources that we have. Again, just to be an echo chamber, the CDC Projectfirstline, those are phenomenal resources there. So we thank you on what you do for our American Indian as well as our Alaskan Natives. And we wish for you to have a good day. So Diane, back to you.
Thank you so much, Kyle. Next slide, please. Just wanting to share with you that our next Projectfirstline activity that will be coming up in about 2 weeks is our ECHO. NCUIH will be launching an open ECHO, which is a community of learning. So you stay tuned. You should be receiving an invite. You should be seeing the promotion in the newsletter and a link to registration. So this will occur on April 12th at 2:30. Next slide. Additional events that will be coming up as well. I'll go ahead and ask Aaliyah to add these in the chat. These are other NCUIH events. Using the personal balance tool for youth self-assessment and goal development. This occurs on April 21st. On the 27th, we have COVID success stories, COVID challenges, and cutting edge innovation. Followed by success stories, mental health for everyone. I do recommend if you are able to join, please do. And on May 10th, we have COVID success stories, the HR challenge, enforcement of COVID-19 mandates, vaccines, retentions, and recruitment. Next slide, please. This is a list of our resources. We will be sharing resources here in the presentation. You will receive an email as well as a reminder to complete the survey. The survey is important. It will tell us if there are additional topics that you would like us to teach on, if you have questions, and what you thought of the presentation. Next slide, please. Thank you so much. Thank you for being here. Thanks to our presenters. We look forward to seeing you at our next event. Have a good day.